Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Our program today will be focused on breast cancer awareness. And joining me in studio is Dr. Shanique Greaves, Technical Officer for Cancers. Welcome to the program, Dr. Greaves.
Thank you for having me.
So we're observing World Breast Cancer Awareness Month under the theme, Every Story is Unique, Every Journey Matters. Could you tell us a little bit about this observance and why it is so important globally as well as in Guyana?
Breast cancer is the most common cancer that affects women in Guyana as well as globally. And as a result of that, it is important that we continue to raise awareness and encourage our women and men to get their routine screening done.
Okay, for our listening and viewing audience who are not so au fait with what breast cancer is, could you go a little bit in depth for us?
So breast cancer is when the cells in your breast tissue, and like I said, breast cancer can occur in both men and women. They start to multiply abnormally, and as a result of that, it changes their genetic composition, and eventually those cells will start to form like a lump in our breast tissue, and of course forming into itself as cancer.
Are there any specific risk factors that will increase a person's chance of developing breast cancer?
Indeed, when we talk about risk factors, these are certain aspects or the factors in our life, whether modifiable or not modifiable, that if a person has some of these factors, it can put you at a higher risk of being more predisposed to disease, and in this case for breast cancer. So as it pertains to those risk factors, we look at persons who have a family history.
Yes.
And those are some of the very early and important questions we tend to ask our patients when they come on board. Do you have a family history, especially if it comes from a first degree, or what we call any of your parents or a sibling that would have been diagnosed with breast cancer. We also speak about the reproductive history of a patient. In some instances, for those persons who would have gotten their menarche or their period early onset, those are some other areas in where, it can also predispose you to having breast cancer. Other than that, we have persons who probably may not have birthed a child, or they don't have any children, or they would have never breastfed their children. Those are other important questions that we also want to find out from our clients or our relatives. And then we talk about our lifestyle changes in terms of persons who live a more sedentary lifestyle, or they're very inactive, don't have much physical activity, and also persons who might be overweight or obese too might also pose at a higher risk of getting breast cancer. And then persons, we also look at age for breast cancer. Ideally, we look at persons above the age of 40, predominantly maybe in their 50s.
Yes.
However, it does not exempt those persons who are below the age of 40, nor above the age of 60 or 70.
Okay, because I was about to ask you how long does the cancer takes to develop, or how early a person can be diagnosed in terms of age. But thank you for clarifying. What has the Ministry of Health been doing in terms of implementations and strategies to bring awareness, sensitize, and also encourage persons in getting screened early?
So here at the Ministry of Health, we have adopted the WHO guidelines, and one of the key aspects in that is that we want to have screening done to at least 70% of our population from between the ages of 40 to 74. And that has become an ongoing screening mechanism that we have implemented across the country.
Indeed. We are going to talk a little bit more about screening, but before we get into that, tell us about the importance of getting screened, because I know many persons are not always open to going and get screened for breast cancer, although we do sensitization and awareness. And so we want persons to become a little bit more comfortable.
Many times we would talk to persons and encourage them to do their own breast self-examination. But in many areas or in many aspects, we might not be able to always feel for a lump, or we might not be sure what we're feeling for. So it is important that we adapt or we do our screening with mammograms. That has become the main or the key aspect, as one of the main aspects when it comes to screening.
Yes.
We use we use the mammograms. Ideally, it is from age 40 to 74. However, there are some cases, if you are below 40 or above 74, once you talk to your healthcare provider and you seek that advice, depending on whatever symptom that you might have underlying, they can advise what would be the right test or exam that you can also get done. But screening is important because we do encourage persons, and I like to say as my motto, early detection saves lives.
Indeed.
The great thing about a mammography is that it can be able to pick up very small lumps that we may not be able to feel, or maybe we might not be able to pick it up on an ultrasound. And as a result of that, just being able to have that early diagnosis increases your chances for your survival rate.
Indeed. What are some of the early signs and symptoms that persons might experience that suggest that something is wrong with the breast?
Cancer, in many occasions, the symptoms are usually asymptomatic. It is usually whenever a patient does come to us with any signs or symptoms, they would more likely be in the more advanced stages as a result of that. Hence why, where we encourage persons to get screened early and let it be a part of your routine, in your lifestyle. However, some of the symptoms that can occur, you might notice a difference in size, like increase in size in your breast. Whereas, we do know that one breast is generally a bit bigger than the other, but if you see it's a notably difference in the sizing, those are some things that you want to look out for. Those are some signs you want to look out for. If we feel a lump under our arm, that's also a cause that we want to visit our healthcare provider. In some instances, we might also see some changes in the skin texture, like in terms of the darkness or the thickening of the skin. And then we have bloody discharge. Not every time you have a bloody discharge, it means, oh no, it's cancer. But we do, like I said, you do want to visit your nearest health facility for them to be able to do the follow-up test on you. And then in other instances, we can have inverted nipple. Now, some persons do generally have inverted nipple as the women or men as they're developing in their adolescent stages. However, if it is you notice that your nipples have always been erect and they've been out, and as time has progressed, one of those nipples start to go in, or it becomes inverted, of course you do want to get that checked out sooner than later.
Thank you, Dr. Greaves. We're going to go into a short break and be right back with more on breast cancer awareness.
Cancer touches every family, every community, every heart.
But together, we can fight back.
Early detection saves lives.
Regular screening is powerful protection.
Healthy habits can lower your risk.
Hope grows stronger when the community stands together.
Support gives strength to those in treatment.
Research brings us closer to cure every day.
Hope is stronger than fear.
Together, we can make cancer a thing of the past.
Your voice can inspire action.
Big or small, check them all. Act now, live strong.
My name is Adele Williams-Sewell. I was born in Guyana and I attended the Bishop's High School. My family immigrated to the UK in 1978 when I was 15 years old. I was diagnosed with breast cancer in January 1999 and I was 35 and a half years old. It was an early stage diagnosis, probably stage 1. I found a lump in my breast. I remember standing up in front of the mirror in the bathroom. I think I might have just had a shower or something, and I thought, oh, that breast looks a little bit fuller than normal. I wasn't aware of any family history. I wasn't a smoker, I wasn't a drinker, and it just didn't seem that there was any reason why I should have cancer. I wasn't panicked or anything like that when I found it. I just knew I'd found a lump, and my sister is a doctor, so I went to see, I think I found the lump in October 1998, and I was going to visit her in America in November for Thanksgiving. So when I was there, I said to her, I've got this lump in my breast. Could you examine me? And she did. And she told me that as soon as I went back to the UK, I should have an appointment to see my doctor. I still dragged my feet a little bit because I wasn't aware of cancer in my family. But eventually, before Christmas, in December of 1998, I went to my GP and she did an examination and she said to me, oh, I don't think this is too serious, but because it's been there for more than a month, I'm going to recommend that you have some further screening. She sent me for a mammogram and in the January, and the mammogram actually didn't show anything. And they said that that was because I was a younger person and my breasts were quite dense. So I then had an ultrasound of my breast, and it was then that they confirmed that it was breast cancer. I remember being quite shocked. At the time, I thought the diagnosis of cancer probably meant death. And, you know, I remember panicking at the time. My daughter was only 4 years old. My husband's father had died a few years earlier of lung cancer. So that had really been my only close family experience of cancer, and unfortunately it had led to someone dying. So I was quite scared, but I had surgery and the surgery was successful. I remember they said that they got a clear margin, which meant that they'd been able to remove all of the cancer. In fact, when they did do the surgery, they found that I had 2 small lumps in the same breast. But they were close together, and that's why they were able to do a lumpectomy. I didn't just have surgery, I also had radiotherapy after the surgery, and that was for 6 weeks. I had radiotherapy and I needed to go to the hospital 3 times a week. The radiotherapy was fairly quickly, within half an hour it would be over, and I was very lucky. I didn't have any side effects from that at all. I think the right breast, which is where I had the surgery, became a little bit darker, like if you've been in the sun, but that soon faded, you know, with time that faded and just went back to normal. I had to have a mammogram every year for the following 5 years, and I was also asked to take a drug called tamoxifen, which suppresses your estrogen. When they did the surgery, they did tests on the tissue, and they found that the cancer was estrogen positive, which means that it feeds on estrogen. So that's why they give you the tablet tamoxifen to take, which suppresses the estrogen in your body. And at the time, they said that 70% of people in my situation would be fine afterwards. So I thought, well, I'm a lucky person. They've given me clear margin. I will just carry on with my life. And that's what I did for many, many years. Family support was extremely important. This was 1999, so we didn't have things like WhatsApp and so on. Overseas calls were still very expensive. But I remember that my sister Yvette, who is the doctor, she called me every single week while I was having treatment. And in fact, she flew down to the UK. So she was there on the day that I had surgery, and there with my husband and my daughter to bring me home from the hospital. And it really, really meant a lot to me. Always be hopeful, to try not to think the worst, try not to allow your mind and your brain to be full of fear, to take each day at a time, and to remember that the statistics for survival from breast cancer are very, very good, provided you take the treatment that is recommended by your doctors. I really do recommend that if your doctors recommend radiotherapy, don't be afraid, take the radiotherapy. For most people, it's painless. And if they recommend taking drugs like tamoxifen afterwards, take those tablets for the period of time that they recommend. If they recommend that you have chemotherapy, take the chemotherapy. If you lose your hair will grow back. So very often the hair grows back thicker and healthier than before, because the hair is starting again like if you were a baby. So it's a full, fresh head of hair. You know, we women, we like to process our hair, we like to blow dry it, we color it and so on. Whereas when you lose all the hair and it grows back, you're getting that fresh, healthy head of hair again. So it can actually be a brand new start for you.
Welcome back to our program. For those of you who have just tuned in, today we're talking about breast cancer awareness. This month we're observing under the theme, every story is unique, every journey matters. Joining me is Dr. Greaves. Dr. Greaves, tell us a little bit about this theme by WHO. What does it mean for women and men? What does it mean?
I mean, it tells us of the journey of every fighter and survivor, and the path that they each had to go on, one of hope and resilience, and just being able to understand that support is needed and that they're not alone. As much as you might have so many things going on in your life, everything that when it comes to cancer, you know, it brings you that hope and it brings you that strength that you need to just keep going. And also as a way of encouraging others, because maybe my journey might have just gotten a little bit, had maybe just ended, or you know, I'm not in the big rush at the moment.
Yeah.
But then there's somebody who's now starting their journey. So it also gives them the encouragement that they need when we tell that story, for them to know that, you know, there's always there's a light at the end of the tunnel.
What can communities, family members, and caregivers do as they support their loved ones who might be going through such a journey?
I know when we think about breast cancer, just cancer in general, it brings about a lot of scary and really hurtful emotions. And as a result of that, so you can imagine the person that has to go through it. As members of the community, you know, it is important that we show these survivors and fighters this as much support as we can, and not just in terms of finances, but when it comes to their physical and when it comes to their mental and social well-being. That is very important too. Something as simple as just calling and checking up on them ever so often. Even some cases, the helping to go with them to the visits to the doctor, a little walk or a little talk with them, something to help them to keep their mind off of all the medication and so many things that they might have, all the burdens that they might be thinking about. And it's important also that we are encouraged to also go and get screened, so that we too can be able to detect where necessary, if it is that we may have a lump that we need to get checked out, or if it is we have another family member that maybe is showing some of the signs and symptoms. We can also encourage them, come on, let's go and get screened, don't delay. You know, we have a culture in Ghana where we wait until the very last, we wait until it affects our day-to-day activities, that we just can't get about to bed, and we say, you know what, I really got to go to see the doctor now. And we need to kind of get out of that culture and start to put our lifestyles and our health as a priority. Rather than putting it in the back burner, it needs to come now to the front of the class, so that we can be able to prioritize that. In order for us to be more productive human beings and members of society, we still need to be healthy and have that healthy mindset.
Indeed. When it comes to getting a mammogram done, what can persons expect when they show up at the health facility? I know many persons are a little hesitant about getting it done because some persons think, oh, this machine is going to squeeze my breast. But could you share with us so that we can have a clearer understanding of what the procedure will be like for those persons who are interested in getting it done?
So again, we do hear a lot of stories and telltales about my mammogram experience, and in many cases it kind of deters other persons from going to also get screened. When it comes to a mammogram, yes, there may be some amount of discomfort. We can't not take that away and say you may have some amount of discomfort, but I like to say it's a short time discomfort for a long time comfort, because knowing that for just these few minutes you are going into just a typical, it's a special type of x-ray. So for those persons who have gotten x-rays done, it's more or less the same kind of mechanism. You go in and then of course you hear about the squeezing of the breast. So yes, there are these two plates that come, the breast is in between, and the two plates do come down to compress a bit. And like I said, it's just for a few minutes so that we can be able to maybe give ourselves some extra time here on earth, because it will be able to recognize that lump and let us know, okay, do I need to get a biopsy done, or what is the next step for me? Or is it just a benign lump, so I don't need to worry about it as much, right? So getting that mammogram done, I know, especially for first timers, it's going to take a lot of courage, but I would like to say, you know, just think about the risk and the benefit. And when you realize that the benefit will outweigh the risk, you will say, you know what, let me go get that mammogram done.
So seeing that I had cancer, I know one thing now: early detection save life. And seeing that I had it, it's not a death sentence. You could pull through it as long as you take your treatment. You're going to see a doctor, you could live long. Because I'm living with it for 4 years. One is 4 years and one is 3 years. I had lung and colon cancer, and I'm still going. So go take your treatment, see your doctor, and live. It's not a death sentence. Stay focused with yourself.
My name is Sharir Chan, and I'm with the Guyana Cancer Society. Prior to being a part of the Cancer Society, I was a part of Guyana Medical Relief. Guyana Medical Relief has been doing outreaches for the past 40 years, helping in the medical area in Guyana. And through these outreaches, especially in the hinterland and in the rural areas, there has rarely been a case where we have not found someone who has been affected by cancer, or a family member of someone who has been affected with cancer. Through this all, we realized that there's a need for a viable organization that helps people to negotiate the path who have been affected with cancer here in Guyana. And hence the formation of Guyana Cancer Society, which has turned out to be a good champion of hope. Along with the Ministry of Health and the other NGOs that are working towards helping various aspects involved with cancer, we are pleased to be a part of that. And that is where the motivation comes, because you're able to help people, whether it's just navigating the system or financially helping them, or getting in touch with relatives, or finding doctors abroad to help them in times when Guyana cannot offer the service that they need. So we're there for that.
All right, so this year, I am happy to say that the Ministry of Health was able to commission 4 new mammography machines, state of the art, in 4 of our regions, regions 2, 6, 9, and 10. We have noticed that prior to these commissionings, the only access to mammography machines would have been in region 4 in Georgetown, the capital. And as a result of that, when you look at factoring costs for persons coming from the hinterland, if they have breast lumps for quite some time, and then when they do get here, get follow-up care to see a surgeon or physician, it really was a bit of a delay.
Yes.
So you were able to have those machines up and running within those regions. So instead of persons having to come down all the way to town, they can go into their hospitals, their regional hospitals, and book that appointment. So don't delay. Now you have no excuse to say that I have to travel to Georgetown. No, you just need to access it right from your regional hospitals. Just go in and talk to your physician so they can assist you with booking that appointment.
All right, let's talk a little bit about treatment. What happens after screening? Once somebody is diagnosed, what happens next? How do they proceed in terms of treatment?
So when it comes to diagnostics, so we do screening mammograms, and then we have our diagnostic mammograms if a lump is found. And depending on that, if the lump is found and it is suspicious for cancer, a biopsy is usually done after that. or in some cases, other advanced studies like an MRI can also be done. So depending on what those results from the biopsy states in terms of staging, or if it confirms the cancer, then ideally a referral is done to the general surgeon doctor for them to be able to take that through. And depending on the stage and the type of cancer, then we will know if we start with chemotherapy or if they go right into surgery. I mean, that in itself comes with its own protocols that usually follows through with the surgeon.
Awesome. Doc, before we end today's program, before we wrap up today's program, do you have any final words of encouragement to those persons who are listening and viewing, those persons who may know of a relative within the age range that needs to get screened now? What would be your encouragement to them?
My encouragement would be to take away the fear and the doubt that we may have, take away all the naysayers and all the external voices that we hear from a cousin, a neighbor, a friend with a past experience, and just leave self and say to yourself, I need to get tested, I need to be screened, I need to have my routine testing done. And from that, you will feel so much more empowered, and you too can be able to empower others to go and get screened. Early detection really and truly does save lives. Unlike cervical cancer, breast cancer is not preventable. The only way we can truly be able to combat the disease is to have our early screening done and to be able to spread awareness. Spread awareness to children, young people, adults, everyone, because we all need to know and be aware of what is going on. This cancer is the most common cancer for women, and as such, it means we need to do something about it, and we can do it today, not tomorrow. Don't delay.
Thank you so much, Dr. Greaves, for joining me in the program today. I want to encourage you and your department to keep up the good work that you guys have been doing at the Ministry of Health. Thank you for joining me in the program today. I'm Host-Alicia Martin saying goodbye for now.